Gauteng, the country's economic hub, is a hive of activity after lockdown restrictions were eased. The province is battling chilly winter temperatures, and our reporter Nqobile Madlala is checking out quarantine sites and now joins me back live from Ekurhuleni, particularly in Kempton Park. Colleague, good morning to you, and hopefully you can hear me by now. I just wanted to know from where you're standing how those quarantine facilities are looking like. I mean, yesterday we had a conversation with the MEC of Health, that's Bandile Masuku, who spoke about bed management, saying those field sites were quite important at this time so we can increase the number of beds in the province. This, of course, as Gauteng is posed to be the epicenter of the virus.
Well, that's right, Dumelo. From where we stand, there are a number of beds in the quarantine sites. Of course, that's separate to the ones that we speak of in hospitals, because, of course, we do understand the province that is working in ensuring that there's more capacity in hospitals, but also in quarantine sites, because remember, some of the hotspots and the people that may have gotten the virus may need areas where they can be kept, and that's why we find ourselves here in Salem Park. And we have had a walkabout. Unfortunately, we keep having some technical issues as we go in, but we have had a walkabout. We've seen red lines, yellow lines, green lines on the floor. We've seen some boards that basically gives us an idea of what happens when you are inside here. But I am joined here by the facility manager, Uthandiwe. Will you please, just starting, when a person comes in, explain to us what is the process, and also just explain to us in terms of the green lines and the red lines.
Okay. My name is Nqobile Madlala, employed by the Department of Health. We are receiving people who are coming from the community. On entry, the security guards, they register the person that's coming in, even the vehicle that they came in, and the next of kin, and then the nurse personnel come and takes the person to the room where they are registered in the room, and we have demarcated the green. It's where it's safe to be, even without a full PPE. However, you should be donning a mask at all times. That is not negotiable. And then the yellow is where we are walking towards the red. And once you are in the red zone, you can never come back the same way. You go in one entry and exit on the other side with a full PPE, and at every exit there is a box that we are using for waste management, that you remove all the PPE, leave there. You are not allowed to move around with the same PPE. We change many times a day.
Of course, one may worry that because you have been accepting people that are positive and they interact with people that may be negative in the front, tell us how you separate those two to make sure that nobody is infected as upon entry.
Okay. We maintain social distancing at all times, and our personnel that are coming into contact with people, they have been trained on how to deal with this. And a mask is the most important thing at all times. A person has to put on their mask, and at the same time we are training even the people who come just from the ambulance. Before they come inside, we indicate to them that we are going to maintain social distancing, put on your mask at all times.
What sort of schedule do you have for people who are in the facility? And just give us an idea if they're negative or positive.
Okay. Currently, we've got 111 positive people who are on site, and in the morning they have the nurse. Every morning and afternoon, the nurse screen them for any symptoms, because we take people who are asymptomatic, we take people without comorbidities, even though there are some people with high blood pressure and sugar diabetes, but we encourage them to come with their medication, and we've got a doctor on site who will check for all the minor cases, and if there's any case that a person is maybe deteriorating, we've got the emergency service at hand that we call, and they come and fetch those people. And on a daily basis, they go out for 20 minutes sunlight as well as 30 minutes exercises with the security personnel taking care of them, and we take them out in small batches under management.
Would you say, obviously, because we know that the cases are rising, is your staff ready to take care of all the numbers that may come in, and how many numbers come in and go out?
Okay. We have seen more than 100 people on site to date, and they come in and go. We are ready. Every day we sit and check the number of rooms that are ready and the linen. We prepare the beds. We have a capacity of plus minus 399 or 400 people that we could take on site, but because they come and go, we have never had a full 400 at a go. So that simply means we have the capacity.
Thank you very much. Obviously, one of the busy sites here in Kempton Park, and just joining us also is the doctor who's also part of the process with the facility manager. But that's basically what's happening here, colleague.
All right, thank you so much, Nqobile Madlala, talking to us about the quarantine facilities in Gauteng and how they are coping with the COVID-19 pandemic.